Hello and welcome to the Analytic Show, the podcast of business through the lens of data science. But together, we'll dive into learning and sharing where various industries are heading and how data and analytics is at the heart of shaping business growth and productivity. Let's spark different ways of thinking about data and analytics that is relevant to you and prepare your business for future disruption. I'm your host, Jason Tan. I'm delighted you could make it on this journey with us. Hey guys, to continue to get support tips, techniques, and tools and learn from the expert, hit that subscribe button wherever you are so we can keep in touch and continue our lifelong learning together. So, are you using your company data to its full potential? Take our embedded analytic assessment to find out your score. A leading organization like Facebook, Apple, Amazon, Netflix, and Google have moved beyond dashboard and embedded data science directly into their daily business operation. With our 3-minute test, you will discover your potential in optimizing customer experience and revenue through embedded analytics. You will gain greater clarity, insight, and advice to embed analytics. Plus, you will receive customized results instantly. Find the link to this assessment in the description of this episode. Good morning, Adam. Welcome to the Analytic Show podcast. Thank you so much for dialing in all the way from Singapore. Great to have you here today.
Thanks a lot, Jason. Happy to be here.
Now, I'm gonna, before we dive into a lot of the stuff that you do professionally, I have a couple of questions for you that I found from my research. Now, the first thing first is you have published several books over the years, and I believe the latest one is called Achieving Transformational Care. Tell us the background of how this book was born.
Sure. So Achieving Transformational Care was conceptualized to address a very specific need, which was to clarify misconceptions, share insights, best practices, strategies on how to optimize existing resources, redefine workflow. This could be administrative or clinical workflow, and then utilizing technologies to achieve quality and meaningful patient-centered care that is ideally sustainable, as opposed to applying stopgap measures to symptoms that we have in the healthcare ecosystem. Now, the original targets of the book, the intended audience, if you will, were tech professionals. And the idea was to empower them with knowledge, understanding of the core body of knowledge, essential when one wants to undertake digital transformation in health. Ideally, this will enable them to communicate and apply health informatics concepts and practices to real-life situations. And this ideally would help achieve better health outcomes. Now, I mentioned this specifically because, again, the original intended audience were tech professionals. But over the course of time, I realized that it was also useful to health professionals as well, because the actual content touches both sides of the spectrum, as well as insights. So you have situations where the tech guys don't understand what the clinical guys are trying to do, and vice versa. Everyone's actually having a similar intention. It's all for the patient, but they're coming from very different lenses due to training, focus on outcome. So in the end, the content was actually suitable for both. And I like to think that it has helped bridge some gaps between the two disciplines. Yeah. So that's achieving transformational care.
When you say the clinical professional, were you referring to the healthcare professional who were treating the patient, or were you referring to the healthcare administration professional who manage the hospital on all those sort of resources?
That's a fantastic question. I would say both. Even within these two spectrum, administrators, of course, with all their best intention, they have to keep health services alive. Someone has to pay for this, right? Sometimes it's the government. More than often, as you would know, healthcare resources are never enough. It's always people not taking care of themselves.
Yeah.
And from the clinical perspective, there would be healthcare professionals who administer the care and also supporting health professionals. So one of the biggest misconception people have is that they think healthcare professionals is in one category. Actually, if you divide it across the care continuum, let's say primary care versus acute care versus tertiary, and the difference is trying to prevent people from getting sick. In acute is when people got sick, but you want to make sure they don't take a turn for the worse. And then tertiary is, that guy is really sick now. What can I do to make him feel better? So if you take diabetes as an example, primary care, perhaps you're trying to prevent the person from being sick. Acute is, okay, this person has an early stage of diabetes. How do I prevent this person from, worsening his or her disease condition? And then tertiary is, okay, this guy got it bad, very late stage diabetes. What can I do to make this person feel good? So even that, there's different healthcare professions come in, and their perspective are different, even among themselves. So yeah, so it's tough at times to get everybody who has the same objective. We all want the patients to get better, but how do we work together with all our different needs and wants to achieve that? It's a challenge. Yeah.
Now, when you were handing down the book, what was the one thing that is most important takeaway that you were thinking that you like people to have when reading this book?
That's another very good question. My key message was to ensure that people walk away understanding that technology is not the key focus when health organization embark on digital transformation projects. It actually sounds weird because if you tell people, hey, I'm going to do, you say, hey, I'm going to do a digital transformation project. Most folks in the healthcare segment will say, okay, digital means technology. Now, don't get me wrong. Technology is very important. It's crucial as a supporting function or an enabling function. So it makes you, enables you to do something that was not possible before. So absolutely crucial. My best example I give people is your Wi-Fi. You go to any organization, you shut down Wi-Fi. That's it. Let's not even talk about anything else. That's basic needs right there. No Wi-Fi, can't do anything. Very important. But through digital transformation, yes, we need technology, but we need to actually ensure underlying systems. And when I say systems here, it's not IT systems. It's the organization, in a sense, where your policies, strategy, culture actually allows you to undertake transformation. So that was my key message, and I gave various examples. And the trick was to ensure that the readers, when they go through this, they do not diminish either roles, because you have different stakeholders coming in looking at the same object, if you will. Some tech folks will think that tech is important. Yes, they are, but that's not the key aim. You use tech for a reason. Similarly, the healthcare professionals, a lot of them will come in, I don't really care about the tech. I just want to serve my patient. Yeah, but without technology, there's a lot of limiting situations. So yeah, the trick was actually to get them to come together. But yeah, this is a good question. The key message I wanted them is to understand technology is not everything. Yes, it's important, but let's take a look at some of the underlying factors as well.
I'm gonna get sidetracked a little bit, talking about writing a book. I think writing a book is probably a bucket list for quite some of the senior leader people. What is your tips when it comes to writing and publishing a book? What is one thing that you wish someone had told you before you start doing?
Okay, okay. What I did when I first started out trying to write a book was I wrote a lot of articles.
Yeah,
I don't do that a lot these days because of work.
yeah,
And the media has changed. These days, the consumer pattern is people like short passages. And I have an issue with that because complex topics can be kept simple, but you need the context.
yes,
But when I first started off writing books, I started with articles, so they were like test balloon, if you will, and I get feedback. This actually helped me a lot in honing the style and the message.
yeah,
So it's like a little bit of a precursor to the book. You see whether the articles were doing great.
yeah.
And what I did was then I sort of break it out into internally. What I did for myself is I broke it out into what I think is relevant to the key topic, and I started releasing articles on those topics just to test the market.
Mhm.
And if that makes sense, I'll actually string all these articles that's already written because they serve as a introduction, if not as a skeleton, and I'll add meat on it and I'll make it flow.
Mm.
So it has been a great learning process for me. Yeah, so that's what I will share with anyone who wants to write a book. It may not be the best method, but it was what I did.
Yeah.
Made it easier because you get multiple products, if you will. So you get articles that people read, and you get feedback,
Mm.
and you when you finally do write the book, you know that there are content that people wants to know, and you expound on it.
Mm.
And so far, it has worked out well. But I have not written a book for quite some time now. Maybe I'll go back after this and start thinking of another title. Yeah.
That's a good advice. Now let's come back to and move into the key body of I wanted to chat with you today. I know you are a chief for the Smart Health Leadership Center of the National University of Singapore at the Institute of System Science. I think I got it all right.
Yes.
But tell us a little bit more about your role and also perhaps about the the center itself.
Sure, sure. More than happy to do that. So I start off with my institute, the Institute of System Science, over at the National University of Singapore. Well, we are a practice-oriented education institute that focus on digital excellence, and we are very industry focused. So, as the chief of the Smart Health Leadership Center, which is part of the institute, I lead a team of very talented health professionals, digital health professionals, to transform the future experience of health and deliver impact through technology, data, design. And how we do this is we try to develop and blend the various disciplines, skills, technologies through the delivery of what we call practice-oriented training. So it must be fit for purpose to the industry. So we do cover theories, but also how to apply that theory in real life context. We also do something what we call leadership, mentorship consulting. This is a little bit different from traditional consulting in the sense that we go in, we actually uh, level up the skill sets of our stakeholders because
Mm,
we're a university, we want to, upskill them so that we can have a proper conversation as opposed to us being consultant. We go in, we listen to a bunch of feedback and then we give you a PowerPoint deck. So we try not to do that. We go in, we train, level up the skill sets, have a good conversation, and we embark on the actual consulting projects together. And by the time the contract term is over, when we leave, the stakeholders are able to continue on. So it doesn't die off, from a typical consulting project. So we do that. And we also do what we call industrial-based applied research. So research must lead to a meaningful or impactful outcome, not just research for the sake of research. And we are very big on collaboration. So we don't believe in doing things by ourselves. That's not possible. We as a center, we collaborate with other practices within the institute. We actively collaborate with other faculties within the university. We collaborate with our stakeholders, industrial stakeholders, the Ministry of Health, hospital systems, community care systems, social sector, etc., etc. So that's basically what the center is about, and it's reflective of what the institute do. Digital. Our core expertise is digital excellence. So we help organizations do digital transformation. Yeah.
And specifically focus on the niche of the healthcare. Is that correct?
That's my center. So my center focuses on health and healthcare, but the entire institute has this core capability. And my colleagues will look at finance, human resources, etc. So for myself, as a health professional, I only look at health. Yeah, health and healthcare. Yeah.
What are the goals that you are aiming to achieve for the Smart Health Leadership Center?
We have very lofty goals, Jason. So
tell us more about it.
Yeah. So our vision, if you will, and we did this as a team. So what I did is I got all my team members together, and we had some brainstorming session because we use a lot of design thinking. So we applied some of these tools internally, and of course with our stakeholders, we came out with the vision. And it is to inspire innovation and co-create transformation of health and social care for a better tomorrow. And we aim to achieve that through cross-industrial collaboration and co-creation. So we actually put it in the statement, in the vision, that it must be co-creation. So it's not just us going in and say, hey, this is how I think we should do it. This is what we want to do. But let's come in together and co-create. Let's do something great and impactful for the health and social care. Yeah. So very, very lofty. Yes.
Now we're going to talk a little bit more about some of the vision. I think we'll touch on that. But the thing that I have been really interested to understand, where myself don't necessarily have the subject matter expertise, is the digital healthcare and the use of the data, analytic, data science, all those sort of things in here. But before that, I wanted to say, I feel like engineering and information technology, IT, have equipped doctors, healthcare with all of these really, really amazing advanced medical equipment, and obviously also the computer system in resources to manage the resources and information. My question then is, and obviously with the podcast that I run, would you say data science, analytic, and AI would take us to the next frontier?
The short answer is absolutely. The longer answer requires some clarification. So yes, you're right. So engineering, information technology has definitely transformed healthcare, making it as an enabler. We can do more, better diagnosis with the aid of equipments. So be it medical devices or computer systems. Because if you look at imaging, for example, with the help of advanced medical equipment and advanced processing, we can now do 3D reconstruction. And from 3D reconstruction, we go further, we can do simulation of surgery. And that's very important. You can actually start measuring what are some of the replacement parts. You can do 3D printing because you can stimulate it. You can actually do a pre-surgery using a computer where to go in, remove tumors or any lesion growth. You could try this before you actually cut the patient open. So the least invasive or most safest route, for example. So these are some of the existing stuff we have seen. So going further, would data science, analytics, AI bring us to the next frontier? Again, the short answer is absolutely. In fact, the way I see it is, if we do not utilize these amazing enabling technologies, we can't cope. So again, so number one is we can't cope. So if I would give you the very simple example is there's simply not enough healthcare professionals. We can't train medical doctors enough, and just generic medical doctors. We can't train nurses enough, generic nurses. There's also specialty. So it takes years and years for them to become good at what they're doing. And humans have limitation. We get tired. We have emotions. So imagine if I had a quarrel with, let's say, my other half tonight. Tomorrow, I'm going to wake up grumpy, lack of sleep. Maybe I got kicked off to sleep on the couch, so I can't perform. And I go into the hospital setting. I'll have fatigue. I'll be emotionally troubled. I can still perform, but not at my optimal best. Now, computers do not have such problems. They have no emotions. They are algorithm-based. They do a few things very well. And of course, that's the limitation. So you must know how to use them well. But if you're clear on what you're doing, using AI actually helps you a lot. It saves you a lot of repetitive tasks, which humans get bored. Once you get bored, you start to daydream, you like it or not. I mean, that's a fact. Humans are, we have limitations. So yeah, that's, I think we need such technologies. And there's also another very important point is that healthcare is evidence-based. So this is where computers with a lot of good data, the emphasis is good data, coupled with analytics and AI can help us a lot. And they can see disease, they can see patterns and trends that sometimes escapes us. So yeah, the short answer again is absolutely. The long answer is a little bit longer.
Can you give us a few real-life example or perhaps case study on how some of these things have a role or play a role in improving the healthcare industry so far?
Oh yeah. So the most obvious one, I'll start with individual. As you know, medicine on the whole is an art and science. We don't have a one-size-fits-all solution. So this is where it's very different from other industry. If a car breaks down, it's specific parts or related parts. If it's finance, you can actually look at certain factors and so can correlate. Even on hindsight, you can actually find out what's going on. Healthcare, a lot of times, it's we look at the symptoms and we try to figure out what's wrong with you, and it takes time. So if I would look at it from an individual, a basis of individual, if I capture good data over time for this individual, I actually have a baseline report. And when I look at individual, I also look at the family history. That's why we have family physician. It's not individual physician, we have family physician. Because if I have captured data about you and your family, I know disease trends and pattern that you yourself may not know. Because these things could be embarrassing to discuss in a family, especially in Asia context. But if I know that your parents, your grandparents have a certain disease patterns, lifestyle, etc., and I have your own personal disease trends and pattern, I can see whether there's a better response to certain drugs. Not everyone reacts to the same drugs in the same manner. Whether a certain treatment is good for you, or would you respond to a better treatment? And this includes medication reaction, dosage. So would you need more or less? Perhaps this guy has a higher metabolism, so you actually have to adjust the medication a little bit. So that's the individual level. From a population level, you can look at social data, environmental data, of course, the individual data as well. And then you can look at what's going on. So hypothetically, you have a situation where a lot of people is coming and they have flu-like symptoms. Of course, nowadays when you say flu-like symptoms, people say, "Oh my God, COVID." but you can actually look at it and say, "Hey, actually, it's hay season, so it's environmental, and it's only happening to this particular area because they are working near farms or something like that." So you can actually look at environmental data and correlate this. Or disease outbreak doesn't have to be a pandemic, a full-scale pandemic like COVID. Even stuff like dengue fever. So if you have actually data from the environment and social data, so you see that actually there's clusters of outbreak for dengue fever, and the environment data indicates that it's been raining, and there's catchment areas chances are, you can actually start to predict hotspots, if you will. There are outbreaks here and there, and you can prescribe intervention. So individual populations, it can expand globally. The recent pandemic, COVID, you can actually start to see disease trends, and you look at intervention remedy. All this, you need data. Healthcare is very data driven, it's evidence based. But the problem is when you have too much data without any tools, humans get lost. We look at the numbers and we just, oh my God, we're overwhelmed. So definitely, this is where analytics, data, and AI help us to uncover possibilities, insights, patterns that are not immediately obvious. So yeah, this is where I think, in fact, there's already been several cases, scenarios that we see on a regular basis where these tools help us tremendously.
Now, speaking of data volume, especially when you were talking about the individual data and also the family data, there were a few things that came to my mind. And I suspect if the situation, it may be also different in the context of Singapore or some other Asian country, so as well in Australia. But the bottom line is, I think the data, and before that, we all know that data is garbage in, garbage out.
Yes.
Garbage in, garbage out. So the part that where I think is one of the biggest challenge is, how do we collect data? How do we manage the data? And how do we have the family data to be used for the other family member purposes? How do we even have data from multiple healthcare clinic or various places that I have been to be stored as into one place as a single source of truth? Obviously, what makes it even more challenging is the privacy issue.
Mm-hmm. Yep.
I don't know what the answer is.
I can give you a quick one. So
Go for
we
it.
face that question all the time.
Yeah.
So to answer the first part, how do you ensure that you collect data from disparate sources and make them work? This is where people like us comes in. We're health informaticians. We are trained to do that. And data in healthcare is a little bit different from data from other industry. We use terminologies and lexicons that's confusing even the health professionals. So this is where informaticians like myself will come in and we will help you set up the policies and enable something we call interoperability. Of course, the question always come out to us would be, hey, how do you address privacy issue? And I like to remind people whenever I hear that, that's not a healthcare problem. That's a policy issue. So in healthcare, we don't have that issue. So it's really the underlying policy. And this is important because it's very important for us to segregate. We will still have to solve the privacy issue. But it's important to remind that it's not a healthcare issue. It's a privacy issue. So let's solve it objectively. Then we look at, but from a healthcare perspective, the challenge is actually collecting data that is meaningful. Yeah, so that's a separate challenge. Yeah.
Is that the same? I know you have worked in Singapore and also implemented the same thing in different Asian country. Is that the same in other Asian country, or is it more challenging? Or what is it like over?
Yeah, it's always challenging. But there's different topics of different areas of challenge at times. So if I were to work in some of the countries where they are geographically much larger than Singapore, and you find a lot of them, infrastructure may be an issue because yes, I have to find a way to share that data.
Yeah.
These days it's getting better, but there's some areas where I work in projects where electricity is an issue. So so there are different types of challenges when it comes to but there's a few common themes that keeps recurring. Is that the ability to capture data that is useful. So let me give you an example. We always have medication as a data point, and you see that everywhere. People say it's medication, and they put down the list of medication that they know of. I always ask people when I see that, I'll say, does this mean medication prescribed or medication consumed? Because it's not immediately obvious. You may think that it's medication prescribed. I may interpret it as medication consumed. This has a downright effect on my next intervention, because if I assume that all these are consumed and there's no effect, that means I'm going to change medication or increase dosage. But prescription doesn't mean consumption. So this is where informaticians like us will come in. We look at data and say, what is the meaning of your data? So this gets a little bit more complicated, unlike other fields, because you do have semantic issues like this. And I'll give you another example. Gender. Most people will say gender, that's male, female, or unknown. Or if you want, you can expand it to 5: male, female, unknown, M to F, F to M. I've actually done a project, my last project before I joined the National University of Singapore. I was in the Kingdom of Saudi Arabia. And it was a large-scale national initiative to enable digital transformation. And one of the things that we did was to control terminologies and lexicon to ensure the center of data, what was the word? The meaning, so source of truth, if you will. And they defined 13 gender, 13. And they're all clinically relevant. Yeah, and they're all clinically relevant. Okay, you can't argue with that. But this is where it gets interesting, because they can have 13, and you bring that same system to Singapore and it says 13. Most people will scratch their head. You know what? We don't really need that much. So how do you then ensure that you get something that's agreeable by all stakeholders? Again, very difficult, because everyone has their own lenses. But in a nutshell, this is what we do as informaticians. So as name implies, informatician, we are very focused on information, not just data. So data must be translated into usable form. So that's information, and that's what we do. Yeah.
My train of thought just escaped me.
No worries.
That was one question I was going to ask you, but it escaped me. Never mind, it will come back. Coming back to just the case study, is there one that you are most looking forward that it would be widely spread and used around the world?
Not really, because it really depends on the segment of care you're looking at. But there's one interesting trend around the world right now. It's been going on for quite some time, but it's getting traction. Is that we are now, healthcare systems around the world in general, we are moving back to the textbook example of preventive care. Now, most people will say, yeah, that makes sense. You want to prevent people from getting sick. But most people don't take care of their health. So you have people going New Year parties, and you ask them, hey, what's your New Year resolution? And they give you lots. I'm going to get healthier this year. I'm going to quit smoking. I'm going to quit drinking. You see them next year at the same party, and they'll tell you the same resolution. They never get onto it, because humans are by nature very short-term creature. They look at things in the short term. So people don't do preventive health for themselves. We tell people, hey, you should do this, but we don't take care of ourselves. But healthcare systems around the world now are realizing that it's too expensive to be in a reactive mode. So I shouldn't really wait for people to get sick. Then I try to intervene. Because at the end of the day, you spend more. And it's not just a matter of money. Even if you are saying that, hey, I don't care, I've got lots of money, GDP, and what have you, you don't get enough healthcare professionals and facilities. It's just illogical. So healthcare systems around the world are more moving towards preventive care. I believe Australia is the same. Singapore, we're doing that. We've been quietly doing that and moving more aggressively these days. So that's the number one use case I'm seeing, not like to see, but I am seeing around the world where, and we use a lot of data. It has to be evidence-based. It has to provide insights, a lot of analytics, a lot of AI. Again, because that's just simply not possible with all these tools.
Hey all, I just want to give a quick shout out about this episode. It's sponsored by the Embedded Analytic program at DDA. And the Embedded Analytic program is designed for senior manager and executive in the business team who want to integrate data science into daily business operation and use it to drive customer experience excellence and revenue. And book unlimited strategy session for a full year and start embedding analytics into the business frontline. For more information about this program, please refer to the description of this episode. Now, let's get on back to the interview. I know there is a special terminology that you use or use to describe the profession that you are in, and it's called health informatics. Now, for the benefit for the benefit of myself and the listener, can you please briefly explain what is health informatics and how it is different to the world that I know, which is data analytics, data science?
This is a very good question. I actually covered this in some of my lecture notes. If you put it simply, there are definitely correlation. Analytics and informatics works closely together. And you might even get someone who is both, someone who's really good at stats. You can do analytics and informatics if you're trained. But the core difference is analytics tells you what's going on, gives you insight, may even predict it. Informatics translate that into actual workflow. Yeah. And we really control terminologies up front. And because you do analytics, you realize that a lot of data scientists, they spend most of the time doing cleaning of data. That's the unglamorous part of the job, but necessary. Yes. Yeah, in healthcare, if we have informaticians up front, we actually control terminologies, etc. So even the example I gave you earlier on, gender, if you had a controlled terminology that we use to acquire data, you don't have to spend that much time cleaning up that data because they are actually classified with vocabularies. So that's one. So this is where informaticians move a little bit towards the beginning. We control data upfront because we want them to be information, not just pure data.
Yep.
And then once you have the analytics, you provide insights. Of course, clinicians must look at it. Healthcare professionals must look at it. And then we decide a method of intervention. Informaticians will then try to implement it with tools as well. So downstream use of data, the example I'd like to give is for a system what we call clinical decision support systems. And this could be acute use. So when you order a medication, and system will actually check with, of course, controlled terminologies. And said, hey, this patient has already had this medication. You're double dosing. So this is a little bit different from analytics. Analytics tells you what happened. In this case, I'm telling you, hey, this is the action that's going to impair quality of care and patient safety. Or it could be a situation where it's overdose. And also I give the overdose, they already had the medication. The other common example is overdose due to body size, like for example, pediatrics, young kids. So they obviously don't have the same body mass, but sometimes when you're prescribing, you may overlook and you may prescribe too much dosage. Or pregnant ladies, they're not supposed to be taking x-rays. Now, some pregnant ladies in the early stage, you can't tell. So the physician actually may not know, but the system may have the data. And then when you try to prescribe, let's say, an x-ray, they'll jump out. So this is just an example that's where it helps you use data effectively during the treatment of care. Of course, analytics plays a huge part, and there are other use cases, but that's the core difference. From a textbook example, again, you may have an informatician who's actually trained to do analytics, and he will be able to do both. So vice versa. And actually, I've seen a lot of guys that especially those who deal with public health. Because in public health, we do epidemiology. That's very similar to analytics. It's the same thing, actually. It's just that we don't use big data. We didn't use big data because big data wasn't available back then. So we weren't trained on that. But these days, if you look at modern public health, they are trained to use big data as well. So it's very similar. So yeah, so that's the very high level, 3,000 feet difference between analytics and informatics. Yep.
What are some of the biggest challenges when it comes to implementing or perhaps even innovating the healthcare industry with informatics, data science, and AI?
Wow, that is a fantastic question, Jason. Generally, there is two major challenges that I personally have faced when I do projects across the globe. Number one is data interoperability. So we sort of explore that, making sure that the data that you capture is controlled. This is tough because different healthcare professionals will come and tell you their definition. They're all correct, depending on how they perceive the subject. So you have to find consensus and control that, and how you translate that into the computer systems and making sure that they follow your standard, because there's different standards around, and everyone thinks that their version is the best.
Yep.
So how do you ensure that you have interoperability of the data? And the second major challenge that I come across is related to the first, is expectation and change management. I keep telling people the biggest problem I have in healthcare are humans.
I can relate to it.
Yeah,
I can so relate to it.
Yeah, so it's tough because there's expectation and change. It's a very complex industry. People die if you make a mistake, so people don't really want to change. In fact, this is how a lot of physicians are trained, muscle memory. And there's always a joke around, but this is true. So you can walk into an emergency department, and you actually have physicians who are taking a break, resting. But there's let's say a car accident, for example. So you try to wake up the resting physician, the emergency department physician. He will be able to wake up and perform surgery on the fly. That's how they're trained, because they go through long period of stints with very minimal sleep. It's not to torture them. It's to train them to react under adverse situation, so they are able to perform and save lives. Now, here's the problem: they're trained to rely a lot on muscle memory. So I see something wrong, I intervene with what is proven. And then you have guys like us that comes in, you know what, from data, we found out that it's actually better to do it the other way. So it actually runs counterintuitive to how they are trained. Of course, they are very open. Healthcare professionals in general, we like to, we want to help people. That's why we're in this job. Industry doesn't pay well, actually. It's very punishing. But underlying, we want to help people. So we like to understand what is the better alternative, but we always like to find out if this has been proven. Now, here's the catch. Someone has to do it in order for it to be proven. Nobody wants, most of us don't want to be the first, because people can die. So imagine you're going around trying to transform health systems and telling people there's actually a better way to do this based on data. I'm not saying that it's impossible. It's just a little bit more challenging in comparison to some of the other industry and sectors. So yeah, this is the two things. They're related. So these are the two things: getting people to standardize on data and using standardized data and vocabulary, and expectation and change management. Yeah, it is. Yeah, very challenging. Yeah.
Do you think you have found a way to solve some of these problems that you described, that you just shared?
I like to think so. I don't have a foolproof methodology, unfortunately. But what I come to realize is that because of the nature, as I described earlier, nature and context, people are not averse to change because they don't want to change. They just want to make sure that if I do this, no one's going to die. That's why, have you actually done this before? Have you tried this? Of course, we have clinical trials, A/B testing, whatever you. So those help. But it's a lot of awareness and education. I realize people are fearful if they've never heard of it. So the first time I tell them is, "Why are you insane?" But if they are made aware, you show them literature, studies that this has been done faithfully. We follow science, so it does help. Yeah. So I realized that awareness, education, always a great starting point. So stuff like this, podcasts, this is fantastic for raising awareness. Even if healthcare professionals are not listening to this, you have tech professionals who listen to, for example, this podcast, and they work in healthcare, and they'll start to understand, oh, there's another spectrum to this. And, they will actually ideally open up perspective. And once people are more receptive, the conversation can take place. Until then, it's really, miscommunication, trying to second guess each other. So yeah, that's not helpful. Yeah. So that's how I tackle it. Yeah.
Well, there has been quite a few healthcare professional coming to the podcast. I will have a few more. So certainly there is a overlap audience over there. Now,
that's fantastic. Yeah.
it is a subject that I'm not so familiar myself, though. So a lot of time I have to rely on research or be super prepared. But I think we are on the right track. Now, moving on to the next part of the question that I have got for you is, I suppose as an outsider who doesn't know much about the healthcare, I feel that the biggest challenge the patient often face is the cost of healthcare. The price seems to be only trending one direction, which is up. And I think there are numbers of reasons that can explain all of those things. But we're not talking about those. But my question, however, is coming back to the data and all of this advancement that we are seeing in the technology and AI. Do you foresee cost reduction in patient billing?
That's a good question. I do get that quite a fair bit when I work with stakeholders when we do digital transformation. They always say, "Hey, this thing is expensive. Can we actually translate that to cost savings?" From a patient, if I were to talk to a patient, the best way I'll tell them is do preventive care, take care of yourself. Clean food, exercise. That's the best way to save money.
Yes.
Yeah, but that's not the topic today. So will adopting all this technology see a cost reduction with regards to patient billing? I think it's a fallacy to think that it will reduce cost. Cost is only going to rise up because someone has to pay for all this. What people don't understand is that it takes money to support technology. You have manpower costs, electricity costs, cloud services, etc., licenses, software licenses, etc., etc. So someone has to pay for all this. But what using all this technology it will not reduce costs. It will control costs. So the better way to see this is as opposed to exponential increase of dollars and cents, and it will. So crazy wall expenditure. Instead of that, if you use technology, you will have a more controlled linear growth. So that's the better way to explain it. And it sometimes when I tell people, financial controllers and what have you that, and of course I have to give more examples, they can sleep better at night. Yeah, but it's really a fallacy. It will not reduce costs because inflation will kick in, manpower, software licenses, even just something as simple as energy cost is rising, and you want to crunch data, whatever you need servers and whatever, data centers, etc. This will cost electricity, money. So yeah, we will not reduce costs, but we can control costs with sensible use of such technologies.
I the thought that escaped me earlier, it finally come back to me. So if that's okay, I'm gonna quickly just jump back.
Sure.
What I was wanted to ask earlier. So earlier on, we talked about the disparity of various data sources, etc. How to you or one control to be able to have all of them into a single place, so the healthcare professional would have all the data in order to provide their advice. One thing that I noticed, and I have never really dived deep enough into the subject, so this is purely just basic information I read, is that in Australia we have the federal government department where they are trying to collect and create that digital health record for each
Mhm.
individual, um, where they can be the single source of truth, which collect all the data from various different sources. It seems like they are still facing problem purely because of the fear of the privacy, which I know you addressed earlier. But it that seems to be still not really solving the problem. I'm curious to know though, is that what is it like in different jurisdiction, different part of the world? What are people trying to achieve? Do people try to achieve exactly something similar where the government comes in to play the role in collecting all the data, or what is it like?
Yeah, there are similar trends. So I think government plays a huge role, especially if they are the major payer, because it
Mm,
makes sense for them to get all this data to look at disease trends and profiles. Um, and then you can design suitable interventions. So I've actually took a look at what happened in Australia. And we have some similar initiatives in Singapore where we try to build a centralized a digital health record, if you will. So one
yeah.
source that has everything. And what I understood was that in Australia, it was a opt-in model. So if you want your data to be collected by the government, you have to explicitly say yes. In
Mm,
Singapore, we went the other way around. It's an opt-out model. Now, if you
right.
think about it, both actually respects privacy.
Yeah.
If you really feel against it, you can choose not to contribute your data. There will be repercussion. It's not that the government is going to purposely come after you or you're not giving me data, so I'm going to make things difficult for you. No, that's not the
Mm,
case. Because if you don't have your data available, then all the good stuff about trending analysis, finding the best patterns, that's not going to happen to you on an individual basis. On a population basis, yes, individual.
yeah.
Then you obviously can't enjoy that because I don't have your data. But back to the opt-in, opt-out model, you must understand human psychology, and they use this in marketing all the time.
Correct.
Most people,
Yes.
most people just don't give two thoughts about it. So if it's yeah, once you enroll me, if I don't mind, I'll leave it. So in the Singapore model, we enroll most of the people. Now the de facto response is actually that's a good thing. I'll just let it be. Now if I'm really against it, I will opt out. Now the same mindset is actually applicable to most people everywhere. Now Australians, I presume so. Most people actually don't mind. But
Yeah.
if you were to make it so troublesome, I have to opt in. It's a deliberate effort for me to,
That's correct.
uh, yeah. So people just say, you know what? Again, people are short-term creatures. As we talk about that, they don't think in general humans don't think long-term. Very few of us do. So if you have to make it so difficult for me, I actually go to deliberately make an effort to get myself to opt in. They don't care because they don't see the long-term implication. That's why I think adoption failed. Again, there's no right or wrong answer, but at least if I were to contrast these two um, policies, if we will,
Mm,
yeah. So it's really sometimes how we architect um, our underlying systems, and we talk about this very early on. It is actually your policies, your strategy, your culture that enables change. So this is related to some of the stuff we talked about earlier. Yeah.
absolutely. Now you talk about prevention is better than cure, which absolutely agree. Um, with a lot of these wearable devices, which also have a lot of the data, especially our movement, and as it continues to advance, it collect even more data. It's to me, I find that it seems like everyone is still struggle to be able to bring those data into an ecosystem where it can really, really benefit the people.
Right.
What do you think is stopping that? What do you think? What do you think is stopping them to succeed? And sorry, when I say no, it seems like everyone hasn't really been able to find a way to bring those data into ecosystem. What I mean is like think about, for example, let's say we have something that is that digital record like the government level, where you can also bring some of these wearable devices into play, but no one is able to do that. Why do you think that's the case?
Oh, that's a good question. I think it's more policy. It's not a technology issue. I mean, if you're already acquiring those data,
Yeah.
of course, you have to standardize how you acquire those data. And
Mm,
those standards are available by and large. It's a matter of actually enabling policies to consume those data. But
mm.
having said that, someone has to pay for that cloud storage, the maintenance of the system. So,
That's
so
good.
maybe I'll flip it the other way around. So, as a healthcare professional, if you give me data, I'll have to ask myself, is this useful for me to make a diagnosis or in any inference?
Mm,
So transfer all data is good, but there will be a situation where it may not be so relevant at that point in time. So let me give you an example. ECGs. We capture electronic cardiographs on a regular basis for checkups and what have you.
yeah.
By and large, these ECGs are not very relevant after 3 months. So if you want a new one, you take another one. This is not like X-rays. They'll be good for maybe quite some time, because if you have a tumor growth, chances are it's not going to be such aggressive. But you can see them. So ECGs. So if someone come in and says, "Hey, I got 2 years worth of ECG, can you put it on your system?" Then I'll most probably someone will look at it and say, "Yeah, no, those are great, but it's not really relevant. What am I going to do with them?" Now, having said that, so that's one context. But if you turn around and says, "Hey, actually, this is a clinical study, and I want to look at past data, long history of past data," so those would be useful. So again, it goes to the context, what you're using those data for. So I guess maybe this is really policy at this point in time. Maybe you don't really need so much data on how many steps you take.
Mm.
This may be useful when there's when there's a good use case for it. All data is good. It's just a question of what is useful at that point in time. Yeah.
Absolutely. I'm glad that I asked those questions to Carlos. Now, to summarize what we have been talking about, I think one of the questions that perhaps that people would be asking is, do you have any advice for the health informatic or people in the data analytic who is looking to focus more on data science for the healthcare transformation journey in their organization?
Yes, I come across that quite often. People try to get into the field, or people who have gotten into the field and they struggle a little bit.
Mm,
Most of the time, it will be the tech folks who struggle, or rather non-healthcare professionals who struggle. Because it's easier for a health professional to learn some data science. You don't have to be a super expert, some, and you can actually start functioning with the help of actual data scientists. But a data scientist, if you come in with no clinical background,
mm,
that person will get lost, very lost. So always try to understand the clinical workflow terminologies and domain of the segment you're working with. So if you're supporting a healthcare professional in the area of cardiology, of course, cardiology is a very big field as well. So for the heart, there'll be maybe specific areas, let's say certain disease trend. Spend time to learn the lingo, what it means, complications. You don't have to make a diagnosis, but you have to understand, terminologies when the healthcare professional use it. Yeah, so that's important. Learn the clinical domain to a certain extent. At least have that conversation.
I feel like it's very similar to what I feel often when I'm talking to my team or the client, which is I think I found that it's super duper important to understand the domain and the subject and the industry, the business itself, what they are trying to achieve. I sometimes joke that your CFO is not going to care about how you transform the data 300 times to get to that optimal data warehouse structure, or how do you I mean, all those things are important, but if you are not certain about if you're not confident about the final number, whether it's correct or not correct, none of those things matter.
Absolutely, Jason. So we have the same situation, similar situation. If you come and tell me how amazing, what sort of great modeling technique, latest computers will be, you fly over us, I'll say that's great. But what is the solution that can either improve quality of care or reduce, adverse situation? How does it help my patients? If you can't answer that, then it's not relevant.
So agree. Now, my final question for you before the other two final question is there anything else that you'd like to share more about your work?
Yeah, so I guess if there's one thing I need to give a shout out, it would
Yes,
be that myself personally and my center, or my institute for that matters, we are big on collaborations. Internationally as well, we do work across the
internationally
globe.
as
Yeah.
well.
So regardless if the listener is from Singapore or somewhere across the world, if you think there's a way to collaborate, it doesn't have to be just purely industrial academia. Have a chat. If you have an idea, or even raising awareness. As we talk about, raising awareness is very important in our discipline as well. Feel free to reach out. And then a conversation doesn't hurt.
Absolutely. I'll make sure that I put the details of the contact of your institute in the podcast and in also all the publications that
Fantastic.
release.
Yep.
Now, my final two questions that I have for you and everyone else. The first thing first is, what is your most important first principle?
Okay, that is a good question. I used to have a lot. It changes. It changes over with new perspective and age. So these days, I remind myself this is something I believe that was said by Bruce Lee. He says, "Be like water." And
Yes.
when I first heard it, I was like, "What are you talking about, dude?" So I went to understand a little bit more. And if I interpret it correctly, what I understand is that it means not to be trapped in a certain mindset.
Yeah.
Instead, be adaptable as the situation change. You change accordingly. Of course, with context, you don't change with no principles. But in general, be like water. Be adaptable. Pivot when necessary. So I think that has worked. That's excellent advice, and sometimes when I do remind myself to do that, it's worked out well for me because this is such a VUCA environment. It's volatile, it's uncertain. You have to be flexible in certain ways and not be so fixated. There's no one size fits all methodology anymore. So be like water, man. Be like water.
I agree. I heard of it, and I think while I could understand it when I was younger, I feel like I could relate to it a lot more as I age. What is one book that you have read and thought it would have been better for your younger self to have?
That is also a good question. Actually, I love books. These days I don't really find enough time, I have to admit, but I really like physical books. I really love physical books. I like them touching. I know it's bad for the environment because we have to cut down trees, but I like the smell books, I like to read books. It's very therapeutic actually. Just do nothing, be with yourself. So there's a lot of great books I've come across. But if If it is one book I'll give to my younger self, I'll say none, because young people don't take advice. Yeah, so we've experienced every little incremental or better obstacle that we overcome, we grow in wisdom, hopefully, and I honestly believe that, and this is something to do with physics as well. Some people say it's superstitious, but it's actually physics. There's no coincidence in life. There's always a pattern that the universe is guiding you. So yeah, there's no point trying to fix the past. Whatever you need to go come across, whatever book that you need to read in that point in time, the universe is going to give it to you. Yeah. Again, people say, hey, this sounds so mythical, but it's physics. There's no coincidence. So yeah, no books, no change of titles for my younger self. Yeah, so that's how I see it. But yeah, I love books. Everybody should be reading more frequent. It really helps you think.
Thank you so much, Adam, for coming on to the show again and sharing on various subjects about the healthcare industry, health informatics, and also about all of these various challenges. But also, I think the important takeaway for me, I found equally, apart from the data, etc., I think is about the working to get the policy right. I think that has been one of the very important takeaways. Thank you.
Yeah. You're welcome, Jason. Thank you for having me. It's been an absolute pleasure.
Hello. If you enjoyed this conversation, hit that subscribe button so we can meet again. If you don't, I'll be stuck in an infinite loop. So pull that part by clicking the subscribe and help me out. You can further support us by leaving us a kind review from wherever you are listening. At the end of the year, I will choose a reviewer to send a special gift to, and it might just be you. I look forward to seeing you here next week for a new adventure, if I can find my way out of this endless loop. See ya!